This video provides Board of Directors, leaders, and physicians a basis to understand what a corporate compliance program is and why the 7 elements are important to include in a hospital's corporate compliance program.
Welcome to our discussion about the importance of establishing an effective corporate compliance program for your hospital and the 7 elements that are the pillars of a corporate compliance program. My name is Joe Watt, a healthcare partner with Forvis, which is a leading public accounting and advisory firm that was created by combining the 2 former firms of BKD and DHG. I have been working with healthcare organizations and their compliance programs since the first compliance program publication by the Office of Inspector General in 1998. Whether it is helping with the development of their corporate compliance program, reviewing their corporate compliance program, providing compliance training, or helping them when they get in trouble with the OIG, I have been working with healthcare organizations to do the right thing. I look forward to our discussion today. The video discusses the importance of a corporate compliance program and revisits the 7 elements that should be included in a corporate compliance program. This short video will give board members, senior management, managers, employees, and physicians a basis to understand what a corporate compliance program is and why the 7 elements are important to include in a corporate compliance program. Attendees will gain a better understanding of why a corporate compliance program is important, an introduction to the 7 elements of a corporate compliance program, and key aspects of each of the 7 elements of a corporate compliance program. On February 23, 1998, the Department of Health and Human Services, Office of Inspector General, published the OIG Compliance Program Guidance for Hospitals, in cooperation with and with input from several provider groups and industry representatives. Many providers and provider organizations expressed an interest in protecting their operations from fraud and abuse through the adoption of a voluntary compliance program. As a result, the OIG developed the compliance program guidance for hospitals to promote a higher level of ethical and lawful conduct throughout the healthcare industry. Although the development of a corporate compliance program is voluntary by healthcare organizations, it is highly recommended. Also, the mere development of a corporate compliance program by a healthcare organization is not enough. The OIG has stated that it must be effective.
Having a bona fide corporate compliance program in place is a CMS condition of participation. When I took this role at Grove Hill Memorial Hospital 2 years ago, there was a corporate compliance plan document stuck in a 3-ring binder. Most of the people around here, they had no idea what you were talking about, but I've learned over the years that a corporate compliance program that is structured properly and functional actually creates a framework that helps you to ensure that you are in compliance with all of the various regulatory requirements that hospitals are expected to adhere to.
Why a corporate compliance program? Money. Healthcare is a huge industry with billions of dollars flowing through healthcare providers daily. Many of the dollars being paid out on patients' behalf are from federal healthcare programs like Medicare, Medicaid, and the Children's Health Insurance Program, as well as commercial payers. With the significant amount of money in the healthcare industry, there is a risk of fraud and abuse, and therefore the federal government, as well as healthcare providers, want to minimize the amount of fraud and abuse through implementing policies and procedures to promote adherence to the applicable laws, rules, and regulations. Having a written corporate compliance program that is approved by the Board of Directors and adopted by management is an organization's public commitment to operate their organization in accordance with the laws, rules, and regulations, and combating fraud and abuse. Not only does the Corporate Compliance Program tell the public that they are committed to operating their organization in accordance with the laws, rules, and regulations, but it also sets the expectation that their employees, agents, and organizations that they do business with commit to it too.
I've also seen a corporate compliance program actually become a vehicle for real performance improvement. For example, in our corporate compliance committee, it's a multidisciplinary committee, and so we have clinical and non-clinical people involved. And of course, we're paying attention to our business practices, to our financial processes, because that's the history of corporate compliance. When it first started over 20 years ago, the idea was to ensure that hospitals were appropriately billing the federal programs, those being Medicare and Medicaid, in the proper way and in a way that could be substantiated. But many of those business processes, the genesis of them is rooted in clinical processes at the bedside. So for example, in properly billing Medicare or Medicaid, it's essential that you have clinical documentation that supports the services that have been rendered to the patient and that you are then billing to be reimbursed for those. The benefit of that is as you improve your clinical documentation, there's a corollary benefit to quality of care because more accurate, more comprehensive medical records, it facilitates the caregiving and the treatment of patients.
The benefits of a corporate compliance program are as follows. It creates a customized approach to an organization's compliance needs. It improves the quality of patient care. It creates a centralized process for distributing key compliance information to the relevant persons. It develops a process for employees and agents to report compliance issues. It develops a system for promptly investigating compliance problems. It develops a system for initiating appropriate corrective actions. And it minimizes the impact of compliance violations through the early detection and reporting. A corporate compliance program is the culmination of an organization's commitment to do the right thing, the adoption of policies and procedures to promote adherence to applicable federal and state laws, the expectation that all employees and agents of the organization and those doing business with the organization commit to following the laws, rules, and regulations governing federal health care programs. And that if an organization stubs its toe in complying with the laws, rules, and regulations, that it will implement corrective actions. A corporate compliance program is based on the federal sentencing guidelines and has 7 basic elements. Develop written policies and procedures, designate a compliance officer and a compliance committee, conduct effective training and education, develop effective lines of communication, enforce standards through well-publicized disciplinary guidelines, perform audits and monitoring of risk areas, respond to detected offenses, and develop corrective action initiatives. Each one of these elements is critical to a compliance program and needs to be operating properly for an organization to have an effective compliance program. Let's look at each element a little closer. As we all know, it is important to have written policies and procedures to clearly document what the organization's policies are and what policies are to be followed. Every compliance program should have a written compliance plan, document, and standards of conduct. The compliance plan should clearly delineate a commitment to compliance by the hospital's board of directors and senior management and other affiliated entities or divisions. The compliance plan should state the organization's mission, goals, and objectives related to compliance and clearly state its expectations related to the compliance of the governing board, officers, managers, employees, physicians, and other persons associated with the organization. The compliance plan is the overarching document for compliance and contains the standards of conduct that the organization will follow to maintain a culture of compliance.
We were fortunate that we had a seasoned clinical department manager. He's very organized, and one of the qualities that he possesses, which I think is essential, is that I find him to be a person of impeccable ethics and integrity.
Every effective compliance program has a designated compliance officer who is responsible for overseeing the compliance activities at the hospital. It is important to have one individual who is the focal point of all compliance activities, and that the individual have the appropriate authority within the hospital to carry out the compliance functions. It is also important for the compliance officer to have direct access to the hospital's governing board and the chief executive officer. Overall, the compliance officer is the quarterback of the compliance program and has duties that may include the following among other duties: overseeing and monitoring the implementation and operations of the compliance program, regular reporting to the board and senior management, periodically revising the compliance plan, developing and coordinating education programs, investigating potential compliance issues, developing policies and processes for reporting potential fraud and abuse without the fear of retaliation. In addition, the compliance officer is usually the chair of the compliance committee, in which individuals from different service lines or departments serve in an advisory role to assist the compliance officer with the implementation of the compliance program. The compliance committee should assist the compliance officer in performing or coordinating the following functions, as well as others: analyze the hospital's environment for risk areas, assess policies and procedures, collaborate with departments to develop standards of conduct and compliance policies and procedures, monitor internal systems and controls to carry out daily operations, determine the appropriate strategies to detect and prevent potential compliance violations, develop a system to obtain, evaluate, and respond to complaints and problems. Overall, the compliance officer and the compliance committee should work closely together with the governing board and chief executive officer to maintain and promote the adherence to the corporate compliance program at the hospital.
I think the first thing that you accomplish in training your employees on corporate compliance is that you send a message. We can say all day that we are committed to ethics and integrity in what we do, but then through the training, not only are we reinforcing that message, but then we're telling our employees, and here's how we plan to do that. It requires everyone's involvement. I mean, clearly one of the aims of corporate compliance is to help you identify, rectify, and then mitigate fraudulent practices within your organization or anything that would cause you to be out of compliance with anything. The example I used of improved clinical documentation, well, that documentation doesn't start in administration. That documentation begins at the bedside with the caregivers. It may not be anything fraudulent, but if you're going to improve your clinical documentation, that requires every nurse, every clinical person to be involved in that. We believe that having our employees trained, again, not only sends the message that we are truly committed to operating an organization that has the highest level of ethics and integrity, but that we're also serious about improvement in the way we do things and in every process. And that's not just on clinically, it's financially, it's administratively, it's in everything that we do.
The proper training and education of the board, senior management, managers, employees, physicians, and other affected persons is critical to having a compliance program operating effectively. Although all the 7 elements of an effective compliance program are important, effective training and education on the compliance plan and standards of conduct is essential to having the compliance program run on all 8 cylinders. Having the board, senior management, managers, employees, physicians, and other affected persons trained on what is expected of them related to the compliance plan and standards of conduct is the foundation for having an effective compliance program. Although all persons should receive basic compliance training and education at the hospital, training and education can be different for the individuals due to their involvement and/or position with the hospital and should be customized to their functions and duties. For example, the board may receive compliance training that focuses on fraud and abuse in the healthcare industry and their fiduciary responsibility for the hospital's compliance program and what they should be doing as board members. Consequently, the employees at the hospital who are responsible for coding and billing of the insurance claims at the hospital may receive specialized compliance training in coding and billing issues and submitting claims for payment. What is important is that the individuals receiving training and education pay attention, document their attendance, test their knowledge at the conclusion of the training, and records be maintained to document their training and education. Targeted training and education for specific individuals could include claim submission, coding, billing claims, cost reporting, marketing processes, contracting, vendor relations. As mentioned before, training and education is the foundation of an effective corporate compliance program, so it is critical that it be provided, tracked, and monitored. The OIG recommends that the hospital establish a process so that the hospital personnel can communicate compliance issues to the compliance officer. The process can include in-person communication, an anonymous hotline or reporting mechanism, or other form of communication. The goal is to provide hospital personnel with several avenues in which to be able to report compliance issues and reduce the potential for fraud and abuse at the hospital. The OIG encourages the use of hotlines, as mentioned before, in which individuals can report compliance issues. The hospital should maintain a log of all the compliance issues received and document what the issue is, the date and time it was received, who reported it, if not received anonymously, follow-up actions, status of the issue, and the date in which it was resolved. This will provide the hospital with a tracking mechanism for all the compliance issues received and the status of them. In addition, the OIG recommends that the hospital have written policies regarding confidentiality and non-retaliation, so that individuals do not feel like if they bring up a potential compliance issue that they will be punished. An effective compliance program must have written disciplinary guidelines to deal with situations of non-compliance with the compliance plan, standards of conduct, hospital policies, and the laws, rules, and regulations overseeing federal health care programs. This will allow for the hospital to communicate to individuals that there are consequences for not following the policies and laws, rules, and regulations. We typically find that hospitals will rely on or incorporate into their human resources disciplinary guidelines to include violations of the compliance plan and standards of conduct, so that the hospital has only one set of disciplinary guidelines to enforce. This is important so that disciplinary actions are consistently enforced throughout the hospital. An ongoing evaluation process is essential for an effective compliance program because the healthcare industry is continually evolving and the risks to healthcare providers are constantly changing with the industry. Therefore, as part of the hospital's compliance program, it will be important for the compliance officer, in consultation with the compliance committee, to determine an audit and monitoring plan. An effective way to monitor the activities of the compliance program is by performing periodic audits of risk areas and regularly reporting the results to the compliance committee, senior management, and the board. One of the questions hospitals must be able to answer related to the compliance program is our compliance plan working properly and is it effective? To answer the above question, the hospital will first have to identify the risk areas and then determine whether those risk areas are best evaluated through monitoring or auditing. The difference between monitoring and auditing is monitoring is a continuous process, where auditing is at a point in time. Both methods serve a unique purpose and are used in evaluating a compliance program's effectiveness. Oftentimes, we see hospitals focus their audits on risk areas such as hospital divisions or service lines, external relationships with third-party contractors, arrangements susceptible to anti-kickback, physician self-referral, CPT, HCPCS, ICD-10 coding, claim development and submission, cost reports. The above are just a few of the areas hospitals perform audits in, and the hospital should base its audit and monitoring process on risk assessments each year. It is important for the compliance officer and compliance committee, board, senior management, and others to critically evaluate the risks to the hospital and then include those risks in the risk assessment and eventually as part of the hospital compliance work plan for the year. In addition, the results of auditing and monitoring activities and any corrective action taken should be documented and maintained in accordance with the hospital's record retention policy. It is very important for hospitals to respond to violations of its compliance program and initiate corrective action plans to address the violation and hopefully prevent it in the future. When misconduct occurs and goes unpunished or without corrective action, it weakens the overall strength of the hospital's compliance program, and individuals and the public have less confidence in the overall strength of the compliance program and the commitment that the hospital will do the right thing when faced with compliance violations. The compliance officer and others should initiate steps to investigate the detected offenses to determine whether a material violation of the law, rules, or regulations occurred, and if so, take corrective action to correct the issue. The compliance officer should maintain documentation of investigation, including a description of the investigative process, copies of interview notes, key documents, a log of the individuals interviewed, and the results of the investigation. In addition, documentation should be maintained regarding any action taken and corrective action taken to address the issue. As a final note on responding to detected offenses and corrective action, if the hospital determines it has violated the law, rules, or regulations, then the hospital should consider contacting a qualified healthcare attorney to guide them through the appropriate self-reporting process. Hospitals must have an effective corporate compliance plan to mitigate fraud and abuse and promote doing business in accordance with the laws, rules, and regulations governing federal healthcare programs. The OIG has provided hospitals with the 7 elements of an effective compliance program and a roadmap to fight fraud and abuse in the healthcare industry. Now it is the responsibility of each hospital's board, senior management, managers, employees, physicians, and others to embrace their compliance program, operate the hospital with a culture of compliance. When people ask me this question, whose responsibility is the corporate compliance program at the hospital? I always answer, it's everyone's.
Thank you for watching this video. For more information, refer to the resource guide or visit the Center's website at ruralcenter.org.